All right, good morning everyone and welcome to the Adaptive PE channel. I've had a lot of requests last week for muscle pain, specifically neck pain. And I also thought I'd touch on hip pain as well, because obviously we're sitting around a lot, we're not moving as much as we should be. For those of you that are, I applaud you, continue moving. For those of you that haven't moved enough, this should be motivation to move more. Now, I've had a lot of complaints from people that their neck's sore, that they can hardly turn their neck, and sometimes that happens when you're maybe sitting too much in one place, or you start to get real tight like that and you suddenly look one direction and it feels like, I can hardly move my neck. Now, years ago, they used to call that a pinched nerve. Whether or not it's a pinched nerve, you don't really know until you get a doctor's diagnosis. But in most cases, it's because there's two primary muscles that's causing you to have a lot of pain. One of them is it's the scalenes, which runs from here all the way down to here. Now, here's a little trick you can do to find out if your scalenes are really giving you problems. You take your finger, you see your ear and your earlobe. If you go just below the earlobe there, right along here, you can kind of feel a bone here, and then you feel your neck muscles just below the jawbone. Put your finger here and just start pushing it all the way down. I guarantee you, you're going to hit a point where you're like, yikes, that really hurts. That's your scalenes. And don't be alarmed if you feel it all the way down into the clavicle or the general shoulder area, okay? That's very common to have tightness there. And there's a lot you can do about it. You don't have to live with that kind of neck pain, okay? So I suffer from that myself quite a bit. But it's something I take care of daily, and it really doesn't bother me most days. So what can you do? First of all, there's some simple stretches that you can do. First thing it involves you doing is just keeping your arms down to the side, and you just simply tilt your neck one direction. I'm going to turn my body so you can see how much of a stretch there is through all these muscles here. And you know, oftentimes if you're tight in the trapezius muscle, that's the muscles next to the neck, those muscles can create a lot of problems in your neck. They work their way up the chain. Okay, so what you do now is you tilt the other direction, and again, let all these muscles stretch, because this is where most of the tension is for people. It's right along here. Just like that. Let it stretch. And relax. Okay, that's a good way to get things started. You can also move your neck, try to move your neck different directions, up, down. But when you move your neck up, try not to stick your neck forward. Elongate your neck, tuck your chin, look up, come down, tuck your chin, bring it back to the middle. Okay, now another rotational movement you can do that's good for the neck is just to rotate one direction. And again, you don't want to rotate with your neck forward. See how my neck is forward? You don't want to do that. You want to elongate the neck, tuck the chin, and rotate this way. That's the proper way to rotate the neck, okay? Because you want to keep your vertebrae in very good alignment. Okay, I'm going to show you one more stretch, but before we get to that, I want to show you my friends here. So, first of all, this is a lacrosse ball. Yes, it's used to play lacrosse. But it also has very good uses for releasing achy muscles, fascia release. I use this for my neck. I also use it for my shoulders. Now, for a lot of you, this may be way too much density because it is very hard. And I know at home watching this, you can't really feel the hardness of it. So the alternative to the lacrosse ball is something called the alpha ball. And this is designed by a yogi aficionado named Jill Miller. And you can actually buy two of these together for $32, or at least last time I checked, it was around $32 on Amazon. You simply open it up and you can take it out. But I'm going to take it out just so you can see what it looks like. And it's very dense as well, but it's softer than this lacrosse ball, and you can see a difference in size. And that plays a big role in terms of which tool that you can decide is good for you. What I want to do is one more stretch. I'm going to put the ball back in this case here. And there's a lot of uses for the alpha ball. I really enjoy using these, especially in this little case here. Okay, oh, and one more tool. We have the Theracane. And if you're not sure what I'm saying, it's basically two words, thera for therapy, and cane, like you're using a cane. But it has that curve on the end. And what's beautiful about this Theracane, it has this tip, and it has so many different ways you can hold it. Now, it's very good for the shoulder as well. That upper trapezius I was talking about earlier, you can dig this thing in here and push down on it, and you'll feel how tight you are in those muscles. And you know, it doesn't take a tremendous amount of tension and force to feel that tension on the muscles. You just want to pin the pain and hold it. Try to get it to release. And when you feel like it's released a little bit, meaning you don't feel as much pain, what you do is maybe move it to another spot and push down more. And what you'll find is you'll hit a few spots where you'll feel this from your neck all the way down to the shoulder. And eventually, oh man, did you hear that pop? I heard it. That's a good way to release the muscles. So you can use this for a number of things. You could even use it on your hips. But before we get into its uses for the hip, let's focus on the neck right now. All right, we have a chair here. I'm going to set the Theracane down. There's a couple stretches you can do on a chair that's quite easy. Let's say we're going to stretch this area here. You just grab the bottom of the chair, tilt the neck to the left, and you want to really hang on here and depress the shoulder. And you'll feel, even you can take your left hand and push down a little bit on the sternum, and those scalene muscles will really get stretched. And this will offer you a lot of relief if you're feeling tightness there. And you know, the other problem with this, we're going to go to the left side now. And again, I'm going to turn from the side so you can see what I'm doing. The other problem when you have a lot of tightness in these neck muscles, they can keep working their way up the chain. And the higher they go, especially if it's in that upper trapezius area here, it can affect the vagus nerve. And the vagus nerve, when it's affected, will oftentimes cause symptoms like lightheadedness, dizziness, and even nausea and headaches. I've been through this myself many times. I've massaged my woman's neck many times because she's gone through it too. I'd say I go through it more than her. But, you know, which leads me to my next point. You want to do these stretches daily because it'll really be good for neck maintenance. And oftentimes you're going to experience more of this time of the year because, not so much this time of the year, but at the moment, because of the COVID-19 crisis, you're sitting more than normal. You're not doing all the activities you normally do. So yeah, it's not uncommon to be reading a book for a long period of time or sitting on a couch and slouching, and it can cause tightness there. And those are really good stretches you can do to loosen up those muscles. And like I said, when they get really tight, especially back here, and it works its way up into that occipital region, you get into the vagus nerve, and when the vagus nerve gets affected, oftentimes you'll get a headache, you'll get some dizziness, you'll get some nausea. So if that's ever an issue, you can always take like some kind of pain medication that's prescribed by your doctor and roll this area out. You know, oftentimes you don't have to take any of that stuff. The rolling does the most work. The medication alone usually doesn't do it. Okay, so moving on now. Let's get to how to use these balls here. I'm going to get the chair out of the way. Now, you don't have to necessarily have a mat. It helps. Makes it a lot easier. What you can do though is get on the carpet or on the floor if it's comfortable. And this is where you have to decide what type of ball you want to use. Now, I'm quite the masochist myself and I can handle a high amount of pain. I find this to be the most effective. Now, the other thing I notice, if you're a person that has maybe some postural issues in that your neck's forward like that, you may want to use the alpha balls instead because they're large enough to get between your neck and the floor. Okay, so first thing I'm going to show you, you're just simply going to lie back. You're going to take a lacrosse ball, and we're just simply going to set it right underneath the neck here. Now you notice I'm putting it right, not too far from the occipital, but a little bit lower and to the right so you feel muscle. You don't ever want to roll bone, you want to roll muscle. Okay, keeping that to the side. Hopefully you can see the space here between my neck, the ball, and the mat. And all I'm simply doing is just putting weight on that ball
And it's direct pressure in those scalene muscles themselves. And what I'm doing is rolling around a little bit till I find a really sore spot, and I've just found one right here. Ay, ay, ay. Okay, so if you get to that point where you feel that extreme pain there, then what I highly suggest you do is pin it and hold it, okay? I know it's gonna hurt. I know it's really uncomfortable feeling, but if you can just weather the storm for about a couple, maybe 30 seconds to a minute and a half, and then once you feel it release a little, move to a different spot, you're gonna feel a lot better. All right, so for some of you at home that have a ball, but maybe it's not, let's say it's a tennis ball. Tennis balls really are not a very good tool for this because they collapse. You want something very dense. A baseball would work. Hell, even a softball would work if it wasn't so big. But again, that might be better if your posture isn't very good. Okay, go ahead and relax. So the next thing we're gonna do, I'm gonna show you how to use the alpha balls for the neck. Now, the one advantage to using these alpha balls, they're much larger, as you can see. The alpha ball is quite a bit larger. So what you do is you take the alpha ball, set it in the same exact spot, and do the same thing. Now, for many of you, this is going to be a more effective tool because you're going to be able to maintain this position without your head touching the mat. You notice my head's not touching the mat because all the weight of my head and neck area is on that alpha ball. And again, you want to have that pressure on the muscle, not on the vertebrae, okay? And you could always move that ball a little bit lower and roll it out some more. And wait, don't be alarmed if you hear some funny like release popping noises and things like that, cracking. Muscles make a lot of noises. It's not necessarily your bone or your vertebrae or your joint that's making that pain. Oftentimes, it's literally the muscles. Okay, so same thing on the left side. It's really pretty much the same thing. I'll quickly show you the left side. Same thing. Put the ball right under here and roll right on it. And when you find that spot, just hold it. Just like that. You see how my neck is directly, the neck muscles are directly on the ball, and I'm kind of on a sideways angle. And that really releases these muscles here. And I'm just kind of opening up wide, stretching all of this out while I do it. And you know, the neat thing about this, you can do this while watching TV. All right. Okay, moving on. So let's say you're still having some difficulty using a single alpha. The crossball's running away. See, that's where the Theracane can come in handy. It'll trap it in place. Okay, we're gonna put the alpha balls back in their net here. Now, this is a really neat tool because look how this is designed. You can literally put this right here, your neck directly on it. Now, each side of your trapezius muscles in your upper neck now are suddenly getting force from the alpha balls. So you could turn a little bit one direction, roll that side, turn a little bit, roll this direction, get that side. And for many of you, this may be the better solution, using the double balls. Now, Say and I have a lot of different tools we use. We actually have something that looks like two lacrosse balls together, conjoined, just like these. And that works really well too. But those are a little more specialized, and you kind of have to search for those. I can leave a link in the comment section if you want to know where to get this stuff. Same thing on that side. Okay, after you've done this, you know, this could take anywhere from 10 or 12, maybe even 15 minutes in some cases, depending on how tight you are. All right, but you'll feel a blood rushing here. You'll kind of feel like your muscles are really worked, but then they're going to relax. And once they relax, you're going to be able to turn your head. Like right now, I can turn my head much better now after having done that. And that's a great thing to do. Like not only to prevent neck pain, but also headaches. Okay, I'm going to come back up on my feet and show you the Theracane next. Now, the beauty of the Theracane is you don't just have to use this for shoulders or for neck or anything like that. You can use these on your hips as well.
let me briefly go over the shoulders. Again, you take this tip right here, and that's what you want to touch the achy muscles with. Now, each hand should touch these handles, and you put it right on that tip, right on the sore muscle, and push down. So that's how you get those upper traps released, and that's a good thing to do if you're going to work your neck, because oftentimes those traps get really tight. And when I say traps, those are trapezius muscles, these upper muscles, upper shoulder muscles. And same thing on the left side, not really any different. Okay, let's say you're pretty sore in your upper back, like in this whole region. What you can do is hold this like you're holding a machine gun. I know you all know how to do that. Take the pin, put it right back here, and just pin right in the rhomboids, just like that. And then what you do on this side is you're actually pushing the theracane away, and that really gets in there and releases those muscles, okay? So there's a lot of different ways you can use the theracane. Now, I know what some of you are probably going to say. Well, Scott, what if I don't have a theracane and I have sore muscles? Well, you don't just have to have a theracane. So for instance, I'm going to grab one more tool, just simply a bar. Be right back. Okay, so if you have any kind of broom handle or any kind of stick at home, it can basically do the same thing that the theracane does. The only benefit of the theracane is it has that curve to it. When you have that curve to it, you can get into really tight places. Now, if it's just straight like this, this will work really good on your thigh muscles, on the back of your legs here, and a lot of times you have pain there and you just don't know it. So what you want to do is take that bar, you could just gently push down on the quad, and you'll find some pain somewhere. Now, we have this muscle that goes all the way down the side. That's called your IT band. It literally goes from the top of the hip here all the way down to where the knee is. If you just gently rub that, it'll really hurt. But when you stop, it'll kind of release and feel a lot better. There was a good crack there. I don't know if the camera picked that up. That's a typical thing that people have, a lot of tightness in the IT band. Now also, if you grab the stick here, or the bar, and get it on the inner thigh and push straight down, you can definitely release a lot of those inner thigh muscles. And there is a real convergence of muscles there. One particular muscle called the sartorius starts on the upper hip and literally goes all the way down next to the knee. And then the way you could tell your sartorius is really giving you a lot of pain, it'll oftentimes mask itself as knee pain. So you'll think, oh, my knee's killing me. And I remember this years ago, I went through this. I took some time off on vacation, didn't really do a lot of physical stuff other than water ski. And I couldn't figure out why my knee was hurting so much. And when I got back, I had a massage therapist work the leg, and he found that sartorius muscle and got all the way down to there. And the closer he got to the knee, I realized, my goodness, it's not the knee that hurts, it's a muscle. It's a very long muscle. It goes from the hip down to the knee. Okay, like I said, if you just have a stick, you can use the stick for these muscles. You don't necessarily have to use the theracane. But if you want, again, you can get these on Amazon. I think these are $20. And it may be hard for you to get at this point, and I wouldn't worry about that because you could even order these from Kaiser Hospital, and they're about the same price. Okay, one other thing I want to show you all. If you are experiencing tightness in the hips, there's a few simple things that you can do to get your hips working better. Now, this isn't about perfection. This is just about sticking within your natural range of motion and trying to improve incrementally. So I'm going to use the chair for balance, standing position. We're going to bring the leg up. Make sure your pants aren't going down. Okay, bring the leg up. Now what you're going to do is just try to externally rotate out, extend the hip back, and bring the leg down, okay? Now that's just a way to go through your hip's natural range of motion. Now the key to this is not to use your spine, not to lift one butt higher than the other. What you want to do, and I'm going to show you from the side view, is reverse the same thing. We're going to go back to full hip extension. Try to bring this out to the side. Now that's as far as I can go. We're going to rotate back in and down. These are basically just hip circles. And you can do them here and down in a standing position, just like that, okay? Now, if you don't quite feel stable doing that, and you're very comfortable getting on and off the ground yourself, you can always do this from all fours. And it's essentially the same thing. I'm going to show you from the side. You want to be nice and stable through here. You don't want to be arching the back. This is called quadruped. We've gone over this many times in some of the videos. What you're going to do is extend the hip back just like that. Bring it to the side, back forward just like that. That's a really simple movement. Okay, we're going to go back out to the side, try to extend the hip back, and then forward. What you don't want to do is lift the leg up like that and rotate your spine, okay? So let's do it one more time, each direction. We're going to extend the hip back, bring it over to the side, and forward. We're going to go up, side, extend back, and down, just like that. And then, of course, you switch to the other side. Same thing, extend the hip back, out to the side, forward and down, up, side, back, and down. Now here's the thing. You may have less range of motion than I have on this. And I can guarantee you, I've got a lot less range of motion than a lot of really in-shape people I know. But I keep working on it and I try to improve my hip mobility because the more mobility you have in the hip, not only are you going to move better, but you're physically going to feel better. You're not going to have so much pain in the glute and in the lower back. That's the main thing. You know, so many of you don't realize a lot of the pain you're experiencing in your back is because of what's going on in the hip. If you just get your hip to move better and your glute muscles, your butt muscles stronger, you'll feel a lot better, okay? I hope this helped you. Please leave any comments, any questions you have, and be sure to like and subscribe to the Adaptive PE channel. It's APE channel. And like I said, leave a comment if you have an idea about something you want me to cover in terms of topics. I'm more than happy to oblige you. All right, thank you everyone, and have a wonderful rest of your day.